Now we are talking about the liver 2. Liver 2, the point is located on the midway between the great toe and then second toe. Point 5 tune proximal. Proximal means very closer and nearer, slightly above. From the web margin between the first and second toe. Yes. Now we understand about the liver 2. 0.5 tune above or proximal to the web margin. You look at the image very clearly, you come to know there are the great toe and then second toe. There is the hollow web margin. Web margin is nothing but this is the web margins. These are the web margins. From here 0.5 tune means is pinky finger width. This is the maximum width of the interphalangeal joint. So proximal to the web margin between the great toe and then second toe. So this particular point is located on that particular region. So where on this liver 3 and liver 2 taking care for the deep peroneal nerve is activated by activating this particular point. The physiology of this particular point is, so liver 2 is the sun point or the depletion point, sedative point, that indicating the excessive energy which is accumulated in the hepatic organ that partially get depleted. When the hypofunction and then hyperfunction, though two physiological aspects of any particular organ, right? So that particular time when the organ have excessive energy or stored energy, that's not passing to the some other organ, because in 24 hours cycle, every 2 hours the one energy pass on to some other energy, right? So for example, you look at one station, the train that stops in one station, that again move after 2 to 3 minutes. So that to be continue every station. So there are the special junction that should be sustained for 10 minutes over there or 15 minutes and half an hour, depend on the particular junction. So in the similar way, when it is stopped in one place, there is a blockages of the track. In the similar way, when the liver 2 is functioning in our body or the organs are functioning, that to be every 2 hours that pass on to the energy to some other organ. That is our cycle. 24 hours, 11 minutes is our cycle. So that particular time, this liver is 1 to 3 is the majorly functioning organ. After the 3 o'clock, that energy pass on to the pulmonary system or the lung system. Lungs started more energy, so on it continuously functioning in our body. So now the liver 2, the major physiology is communicating to the some other organ. That means the energy is stored over there, that to be passed to the sun organ. The liver is the mother organ that passing to the sun. So which is the sun for the liver? Heart. That should passes to the heart. So therefore now you remember liver 2 is energy, I told you, is the sun point that indicating is the sedative point. Liver energy gets sedated, that passing to the heart system, that passing to the pericardium and then heart. So therefore when the heart having the malfunction, that time to connect to the heart, I told you when the liver is not supported to the heart and the heart cannot govern the entire system of the organ until without support of the liver system. Now it is important that you wanted to treat for the cardiac system, then you remember until you don't connect to the liver 2 and then H9, both the points are very equal proportionally functioning. Liver 2 is equivalent to the H9. Liver 2 is equal to the H9. So therefore when H9 is the mother point, liver 2 is the sun point, it is the communicating each other. So therefore when there is the liver having the excessive energy, that particular time is supporting to the cardiac system. Whether you just applied that reaching to the cardiac system. So therefore liver 2 is the point, is sun point. Of course at the same time this is functioning point to the cardiac system. When the liver fire is get excessiveness, you understand, when the liver having the more energy, so that means it's reflect on our eye system, that is kind of the redness and swelling in the vision. That particular time when the liver fire or the liver yang get flares up, so that particular time to deplete the liver energy, so that particular moment we just use the liver 2. When the patient is complaining, I do have the blurriness in my eyes and I can't see precisely, that means the cloudy is there, then you understand the darkness is there, there is no brightness. When the liver brightness or the liver yang you need to increase, so that particular time if we wanted to see that, the brightness is required. When you look at about, there is in the night time there is no lights and all, the eyes are really good, so even you can able to see that, you can't see that. In the similar way in the daytime the brightness is there but you can't see anymore, so that particular time there is the cloudiness is there or the darkness is there in the vision system. That to open up that, so you need the brightness, you need the fire. Fire is the brightness or the yang ming. So that particular time liver 2 is the fire point. If the fire is opening to the vision, so that particular time now I can see something is different. So in the similar way, no doubt there are the eye points or local points are there. Apart from that, you wanted to use the liver 2 point, that you are opening to the eye system, you are giving the brightness to the eye system. When the patient is complaining, it is the too much heat in the eye system, too much heat is indicating in the hepatic system. When the liver have the excessive fire is flares up or the liver yang is excessiveness, so that particular time liver 2 will be helpful to open up the fire, and that is releasing the fire in the hepatic organ. So therefore the गर्मी अगर ज़्यादा शरीर में हो गई है, लिवर की गर्मी ज़्यादा होने के कारण पूरे बदन में शरीर में भी गर्मी महसूस हो सकती है. No doubt the small intestine is taking care of the heat and a triple warmer is taking care of the thermodynamic in our body. At the same time liver also taking care of that particular area. At the same time particular whole body it gets the excessive heat. So that reflects especially जब आँख देखते हैं तो क्यों इतने लाल हो गए हैं, इसका मतलब क्या है कि आपका आँखों में प्रॉब्लम, पूरी नींद तो हुई है, अगर नींद नहीं होती है तो लोगों को आँखों में ज़्यादा गर्मी के कारण फील होता है कि आँखों में लालापन. लेकिन वही चीज़ अगर पूरी नींद भी हो गई उसके बावजूद भी मरीज़ बोलता है कि मेरे आंखें लाल हैं, तो आप मान लीजिए कि लिवर हेपेटिक फायर इज गेट्स फ्लेयर्स अप, उसका रिफ्लेक्ट होता है आंखों में. दैट लीड्स टू द काइंड ऑफ द एक्सेसिव हीट इन द लिवर सिस्टम. अगर आंखों के हीट को कम करना है, गर्मी को, ऊर्जा को कम करना है, then of course you just apply the liver 2 is precisely good. Once you activate the liver 2 as a sedative point, sedate the liver 2 energy, right? So once you do this procedure, that is taking care not only for the vision, सर की गर्मी भी कम कर देती है, शरीर की गर्मी भी कम कर देती हैं. Of course at the same time the patient is complaining, I do have the my limbs, that means upper limbs or the lower limbs especially, मुझे बहुत ऊर्जा गर्मी फील होती है. then the liver fire get excessiveness, उस गर्मी को कम करने के लिए भी हम लोग we just use the liver 2 point also to deplete the excessive fire on the lower extremities as well, right? liver 2 का major function again we understand about the detoxification, detoxify. इसका मतलब है जो टॉक्सिन्स एक्यूमुलेशन होकर हैं, हेपेटोटॉक्सिसिटी हो गया है, लिवर टॉक्सिसिटी हो गया है, लिवर में टॉक्सिन्स एक्यूमुलेशन हो गया है, रबिश सब्सटेंसेस एक्यूमुलेशन हो गया है, तो फिर उसको हम लोग डिस्ट्रॉय करना है, तो फिर हम लोग ब्लड के ज़रिए से ब्लड प्यूरीफाई भी होता है लिवर टू एक्टिवेट करने के कारण. जो ब्लड में ज़्यादा खून में गर्मी बढ़ गई है तो फिर खून की गर्मी भी कम करती है. नो डाउट द पॉइंट इज द चूची वी कॉल एज ए Li11. द सेकेंड पॉइंट इज लिवर 2. दिस बोथ द पॉइंट्स आर गुड पॉइंट फॉर द कूलिंग ऑफ द ब्लड टू बी टेकन प्लेस, इंक्लूडिंग द सुहाई जो स्प्लीन 10 कहते हैं. तो दैट 3 पॉइंट्स collectively is good point to treat for the cooling of the blood to be taken place by activating to the liver 2. जब बुखार भी बढ़ जाती है शरीर में, so that particular condition you wanted to deplete that energy, so that time also liver 2 is precisely functioning during the temperature as well, isn't it? So liver 2, now we understand for the vision related problem, head related disorders, of course the metabolism to be taken place, but especially liver 2 also good to treat and control for the diabetes mellitus as well. So diabetes को control करने में भी आप single महत्वपूर्ण point use कर सकते हैं. No doubt so many points are existing, but liver 2 also good point to treat for the diabetes mellitus and also related to the complications as well, right? Now we are talking about the liver 3 is the Tai Chung. Liver 3 nearly 2 chun proximal to the web margin between the first and second toe at the junction of the metatarsal bones. कहाँ पे है? You look at the image, midway between the great toe and then second toe, in the hollow depression next to the metatarsal bones. So this particular point is known as a super qualified VVIP point. We can consider this because this point to be known as a source point, Yuan source point, or the connecting point, we called as a receiving the energy from the coupled organ. Now you understand, we wanted to treat for the coupled organ, husband and wife together, or the Zhang Fu to be connected, or the interior and exterior to be connected, liver and gallbladder to be connected, and the whole metabolism to be taken place. Of course, the liver 3 point is precisely good to treat for the miscellaneous diseases anywhere in the body. From the top to bottom, we do have any kind of the diseases. That diseases can be treatable by activating to the liver 3 point. Liver 3 is the point is known as the, there are totally the 14 number of the points are located in the hepatic system. One among them is the super principal point or the super qualified point, Mahatpuran point in our body. We can consider not only related to the organ but at the same time in the whole body. Now we understand the top 10 points in our body is the VVIP point. Among them is the liver 3 is the one among them is the beautiful point to treat for the numerous diseases. Now I can say hundreds of diseases. Even one author has written 10,000 related diseases also can be treatable by activating to the single point. That point to be known as a Tai Chung liver 3. So liver 3 is the, no doubt it is the source point, at the same time is the shoe stream point. Stream point, that means indicating any kind of the wind related disorders, any kind of the earth related disorders. Earth is related to the fleshes and muscles to be taken care. Liver 3, that means indicating to the wind related problem. Where is the sinews? Sinews means is the tendon related problem, muscle related problem. You understand, liver 3 is communicating to the hard muscles and then soft muscles to be taken care by activating to the liver 3. Now you remember, liver 3 is the point is equivalent to the spleen 1. Liver 3 is equal to the spleen 1. You remember that spleen 1 is the grandmother point, liver 3 is the grandson point, sedative point, depletion point. At the same time it receives the energy because it is the source point as well. When the liver 3 is the preventive point, according to the evidence based applications, you remember scientifically the people has been proven that this point to be treatable for the prophylaxis of the various diseases. When the person is as a preventing purpose, they wanted to use this point for the should not come the diseases to attack to our body. In that condition, wanted to prevent for any kind of the diseases or the degenerative diseases or the locomotor diseases or the genetic diseases should not come to our body. And that particular situation, it is recommended to use the liver 3 as a activation for the prevention purpose as well. Now you remember, liver 3 is not only treating to the liver organ and then spleen and pancreas. Of course, this point is communicating both the organ, thereby it is treating to the liver organ, it is treating to the pancreas, it is treating to the spleen as well. Now you understand, when the spleen and then liver 3 both are communicating together, then you understand the maximum metabolism disorders, metabolic disorders, diabetes conditions, definitely this both the points. In fact, I have written the one article last week that has been published in the newspaper. There I have given this particular point. Liver 3 is precisely good to control and to regulate the diabetes mellitus as well. Why is it so? Because the liver 3 is communicating point to treat for the spleen and pancreas organ. When you are treating the liver 3 on the right side, that always is good to control the diabetes. When you are treating by using the liver 3 on the left foot, so that will be treating for the metabolism related disorders. Both the points are really good to treat for the diabetes mellitus and also to control the hypertension. Remember, the people today, the most of the, I think 10 out of 10, around more than 3 to 4 people are suffering today for the diabetes mellitus and hypertension. So both the conditions, the people who are suffering, ask them to activate this one single point every day, twice in a day, morning 2 minutes and then same time is the night 2 minutes. Definitely I do have the hope that they can prevent further complications. At the same time, the people who consume the lot of medications or the glycosides or some kind of the antihypertensive medicines, that can be minimized. The people who don't consider for the type 1 diabetes mellitus, the people who consume or uses the insulin directly, so that particular time I don't recommend much, because we don't want to take much complication to put this word to that kind of the patient, because insulin taking people are the pancreas, so is totally, it is the very very dull, weak and could not able to produce the insulin by the beta cells. So that particular time we don't recommend that to use this point, because that get any time is the low or the excessive or the deficiency. So that particular time please don't recommend. Apart from that, type 2 diabetes mellitus, primary hypertension condition, the people, due to that reason the excessive fire is there in the liver organ, due to that reason the patient don't sleep precisely. That time you wanted to make them to sleep normally, so we can use the liver 3 is the good point to induces the natural sleep. And also this point is releasing is the melatonin in our brain system. No doubt the Tung Tian and then Lo Chu, that point is known as a UB8. UB8 point is good point where the melatonin is released for the inducing the natural sleep. This also will be precisely good to activating to the inducing the natural sleep. So that's the reason this also acts as a hypertension pills. How the beta blocker, calcium channel blocker, inhibitors, which we call as a anti-streptolysin O titer inhibitors, something like that, this also works to control the hypertension. So now you understand the another beauty of this particular point. According to the research, evidence-based applications now has been identified that when we applied the liver 3 and then the another point to be known as a HOKU. The point is Li4 and then liver 3. Li4 is located midway between the thumb and then first finger. You understand in the web margin valley of the muscles, interosseous muscles. Now you look at about the liver 3 also located on the interosseous muscles on the dorsum of the foot region. So liver 3 is on the same region. Li4 is in the same region. This is on the hand, that's on the leg. This point also called as a yuan source point of the Li4. At the same time, liver 3 also yuan source point of the liver. You remember, this is the Yang Ming point, this is the Zhu Yin point. Collectively together, it's really amazing. If you apply this, you wanted to open this, because there are the gates are there in our body. So many gates are there. So in that there are the 4 gates are there in our body. Especially is the right gate and left gate, right foot gate and left foot gate. So you wanted to open for the upper extremities opening the gate to be known as a Hoku. Hoku means normally we pronounce as a Hegu. Hegu is a He H-E-G-U, Hegu, but according to the Chinese pronunciation is Hoku. Hoku and then Tai Chung. So this both the points to be connected together. If you applied the both the points is the liver Li4 on the bilaterally, at the same time liver 3 bilaterally, you can understand this is eliminating the wind and then exterior excessive heat will going to dispel in our body. That means whatever the heat is accumulated here, that will going to destroy that. At the same time upper extremities to be regulated by activating the Li4. Now we understand there is the distal point for the face and head and neck. So which is the distal point? No doubt is the Hoku. This Hoku is there. At the same time, according to the Cambodian or the where there are the spiritual axis books are there. So some of the ancient books they says that this is opening to the upper extremities, liver 3 is opening to the lower extremities. So therefore both the extremities, when we totally applied the 4, once you open the 4 gates, that to be discharged the energy to the upper extremities and lower extremities, because the Li4 the maximum all the 6 Fu Viscera source points are communicating on the Hoku. At the same time is the 6 Sang Viscera source points are communicating on the Tai Chung region. So therefore now we remember that by activating these 4 gates opening, that will be helpful for the POS syndromes. That means we call as a painful obstructive syndromes to be treatable by activating this point. Anywhere in the body the patient is complaining about I do have the whole body pain, I do have some kind of the rigidity in my muscles or the spasticity. So that particular condition you wanted to open that, so you just open the 4 gates. Use the bilaterally. If the person I am telling you is the secret, so when you could not able to identify precisely what could be the reason to cause this kind of the pain or some kind of the other problems the patient is suffering, which could not able to recognize the pathology, that means is not the mean that I am telling you don't any kind of the investigation you just don't do. At the same time you don't analyze the patient and randomly you just apply. But however I am talking about the clinical acupuncture. Now the patient is coming to you, you could not able to recognize the pathology. On that particular situation you just open up the 4 gates from the upper 2 gates and the lower 2 gates. That means you understand one gate is open. For example, you look at about the KRS dam, so many gates are existing. At least 5 gates or 2 gates you just open, that can be survival to be taken place for the several towns and several villages, isn't it? So in the similar way it's open all the gates, the entire Karnataka or the South Karnataka to be taken place by activating all the gates once will open, that will be taken care for South India as well. So therefore you remember when we open these 4 gates, upper extremities, that means is passing to the hands and passing to the head and passing to the neck region and also to the above the diaphragm. Above the diaphragm this Li4 is activated then bilaterally with the EA. EA is indicating is the electroacupuncture. MA is indicating as the manual acupuncture. If you activate as a EA, electrical acupuncture, if you could not able to get that EA, you just use the MA. So MA is the manual stimulation strongly, you just activate bilaterally and lower extremities as well as the liver 3. Definitely that have the awesome results. The patient feel the free flow of the chi, free flow of the su, free flow of the blood, free flow of the chin A, that is the body fluids as well. Once the chi and then blood, wherever there is the obstruction, painful syndromes are there due to the obstruction of the energy or the due to the obstruction of the blood flow, so that leads to the diseases. On that particular time strongly manipulation by activating to the liver 3 and then Li4 bilaterally, that you are treating to, here is the radial nerve, there you are treating to the peroneal nerve. With the peroneal nerve you are activating, at the same time the shin bone nerve, which we call as a tibial nerve. also activated by using that liver 3 point. You understand when you do this procedure, definitely that's treating for the knee pain, especially the distal point for the knee region. If the patient is complaining on the medial side of the knee pain, so that particular time is the distal point for the knee is liver 3. When you apply the pericardium 6 on the opposite side, non-affected side, and then liver 3 on the affected knee, so precisely good to treat for the numerous knee related problems, especially on the medial side of the knee or the medial cruciate ligament where the genicular artery get affected. So that particular condition also you can use by activating to the liver 3. Once you treat for the knee pain, at the same time liver 3 is being the source point. Now you remember what the physiology told about the entire TCM perspective of the function of the liver. All the physiological aspect to be taken place, of course, is the metabolism precisely to be taken place by activating to the liver 3. Right, once you liver 3 you are wanted to activate that particular area when having the imbalance, so that particular time the back also affected. You remember whenever you wanted to treat some particular disease or particular part, so dermatome, myotome, sclerotome, syndrome, enterotome, also keep it in your mind, so that when there is the problem is there, that particular time you just activate on your lower back. So lower back is regulating to the that particular toe as well. When the patient is telling that extensor are not good, so that particular time also you can activate by using the liver 3. And then Pa Feng, Pa means is the 8, Feng means is the wind. At the same time Feng means is the evils, or the Feng means another meaning is called as a pathogens. When the pathogens, 8 pathogens affected on the lower extremities, due to that reason the wind get excessiveness, could not able to lift the toes precisely, extensor and flexors are very poor. That particular time you just activate the liver 3 and then liver 2, that also good. At the same time patient is complaining about the foot drop, so that condition also Chung Yang, that is the stomach 42 and then liver 3, both the points are good. At the same time we have to treat for the anterior tibialis muscles which is communicating to the stomach meridian. All the stomach meridian points below the knee to be activated for the foot drop as well. So isn't it? So liver 3 is the maximum physiological aspect. So hopefully once if now we understand, we completed the liver meridian. You remember that we completed the liver meridian. 1, 2, 3 quite enough. अगर आपने liver को activate करना है, you just activate 1, 2, 3. Any problem related to the liver, अगर आपको पता ही नहीं चल रही, you wanted to treat liver, you can treat by using these 3 points also. इतना महत्वपूर्ण पॉइंट है, इसको इतना सुपर सिंपल नहीं लेना है. कोई ने कहा the people who are treating for the more than 5 decades by using the acupressure and acupuncture, the person says बीमारी आने से मजबूर हो जाता है जब आप liver 3 को एक्टिवेट करते हैं. तो क्या बीमारी आने से, बीमारी आना तो बीमारी सोचती है कि मैं जाऊं उसको, इसका मतलब इतना महत्वपूर्ण है. उस यू जस्ट एक्टिवेट. अभी अगर आप महत्वपूर्ण नहीं हैं, आप लोग क्यों नहीं हैं? नोबडी स्ट्रेच्ड द फुट, राइट. सो आपने खुद आप एक्टिवेट कर लो. जब भी आप बैठे हो, अभी गोल्डन अपॉर्चुनिटी, आप जब बैठते हो घर में जाना है तो फिर आप लेजीनेस हो जाते हो. सो यू विल बी अकम्पाइनिंग वेरियस वर्क्स. वेन एवर यू हैव द अपॉर्चुनिटी यू जस्ट एक्टिवेट. जब भी मैंने क्या कहा, जब मैं खुद पढ़ता हूँ, कुछ करता हूँ, तो फिर मैं खुद एक्टिवेट कर लेता हूँ ताकि मुझे भी वक्त में नहीं मिलता. सो दिस विल बी द बोनस फॉर एवरी वन. वेन एवर यू गेट द अपॉर्चुनिटी आप एक्टिवेट करते रहो, सुनते भी रहो, एक्टिवेट भी करते रहो. When you are thinking, when you are listening, you are activating, definitely that will going to activate your liver organ. लिवर मेरिडियन नहीं, लिवर ऑर्गन को आप एक्टिवेट कर लेते हैं. इतना अगर फुगुट में मिल रहा है तो फिर आप लोग क्यों इस्तेमाल नहीं कर सकते भाई? Isn't it? अरे फ्री मिल रहा कोई चीज़ आपको. ऑर्गन के लिवर स्टिमुलिव सिरप, लिव 52 सिरप और द सम लिवोमिन सिरप, कुछ भी लेने की ज़रूरत नहीं है आपको. तो फिर नेचुरली आपका ऊर्जा बढ़ रहा है लिवर का. लिवर का एंजाइम अल्कलाइन फॉस्फेटेज नॉर्मल हो रहा है, SGOT SGPT नॉर्मल हो रहा है आपका, और जॉन्डिस रेगुलेट हो रहा है आपका. तो फिर आप क्यों चिंता करते हो? Isn't it? इसके बाद करेंगे रियली, राइट. सो लिसन वेरी केयरफुली, दिस ऑल्सो वेरी वेरी इंपॉर्टेंट. क्या सर सब इम्पॉर्टेंट बोलते हैं तुम्हें, कौन सा अनइम्पॉर्टेंट पॉइंट है? अगर हैं गिने चुने, मगर उस पॉइंट्स को अगर उसके डीप नॉलेज अगर जानते हैं, सो रियली यू लव टू द सब्जेक्ट. नहीं तो पता नहीं, मैंने बोला पूछते हैं फ़ोन से सर कुछ बिंदु बता दो, और कोई टेक्स्ट बुक देखते हो, देन यू अंडरस्टैंड सम प्रोटोकॉल्स, लिवर 2 इज़ गुड, लिवर 1 इज़ गुड, तो फिर वो देखते हैं आप लगाते हैं. तो ऐसा नहीं होना चाहिए. यहाँ पे पढ़ने वाले आप इनोवेटिव मेथड से जाना है. ऐसा नहीं कि अपनी जो मैंने बोला वो करना है या फिर बुक है वो करना है, ऐसा नहीं होना चाहिए. आप अलग तरीके से समझिए, क्योंकि मैंने आपको एक एक बिंदु का भी बहुत फिलॉसफिकल एस्पेक्ट पे बात करता हूँ. साइंटिफिकली वो आपके लिए फ़ायदा होगा फ्यूचर में. नाउ वी आर टॉकिंग about, I think some disturbances are there. I have done the unmute, right?